Watch this morning, where we discuss all of the topics trending in the medical fields. Tim is hanging out in the studio now with Dr. Syed Hussain. Good morning.
Good morning to you. Yes, time willing, we've got 3 topics we'd like to get to. Good to see you again, Doctor.
Likewise.
Glad to have you here. First things first, let's talk about the Food and Drug Administration. It has banned red dye number 3. And that is not something all that surprising, I don't think, right? What is behind the ban?
Yeah, so Tim, a couple decades ago, actually 3 decades ago, the FDA banned the use of red number 3.
Yep.
It's a dye, it's a colorant used as an additive to lend color to food. But this was banned in cosmetics and non-oral medications based on studies that were done a few decades ago that showed that when in the lab, when rats ate this dye, they develop cancer.
Yeah.
Now, subsequent studies have really, been a little gray in terms of the, not black and white.
Yes.
And some have shown that this may be the case, but long story short, this has now come to the point where the FDA says, based on, public consumer advocacy and all of that's been going on. California banned this last year as well.
Yeah.
That now is the time to pull the trigger. Now, I do want viewers to keep in mind, it'll take 2 to 3 years before manufacturers actually have to pull this ingredient from products. So what you need to do is look at ingredient labels, food labels, to make sure there's no red 3 or red number 3 in candy, yogurt, chocolate, anything that may have a red color to it, gummy bears.
Yeah.
Things like that. Cake, icing, for instance.
Absolutely, yeah.
Cake.
Because sometimes that even comes off on your fingers.
Right.
Real quick, I know some advocacy groups have been tying red dye number 3 to either attentional problems in children or behavioral problems in children. Where does the literature stand with that?
Yeah, there have been studies around that. So it's still a little, controversial, but there have been studies on maybe leading to some behavioral issues with children. There's enough out there now to suggest that let's pull this. We don't need the red color.
Correct.
If there are so many doubts about health-related issues, it's not worth it.
Yeah, even if we don't know all of the drawbacks,
That's
still
right.
looking at the benefits, there's just not much.
Absolutely.
I mean, unless you really, really like red color, but there's other ways to get it. All right, processed red meats. They've been tied to all sorts of health issues. Now we're seeing maybe a link to dementia or brain health. How strong is that connection?
So this is an observational studies. We've discussed this in the past. So you could only say there's a strong association, which the study suggests. It's looking at over 130,000 people over a large period of time, Tim.
Yeah.
And basically, here's the thing. Bottom line is, if you're consuming processed red meat, so that's bacon or hot dogs, those individuals who take a quarter of a serving, and a serving can be 2 slices of bacon or 1 hot dog, right, per day, as opposed to those that take 1/10 of a serving or less, no red meat in their diet, are 13% higher to develop dementia over a period of time. And we know that red meat consumption, especially processed red meat, is not good for the heart.
Yeah.
And now there's more, discussion, medical conversations going on about what it may imply in terms of cognitive health, brain health.
All right. What is it about the processing?
Yeah,
Is
great
it
question.
nitrates,
So it
salt?
may be some saturated fat that's in processed, the additives that go in, nitrites, for instance, but also there's a compound that's developed that can cause cardiovascular issues that may also impact the brain. So all taken together, these are theories, all taken together may be leading to this slow cognitive decline associated with red meat. There needs to be more studies, more cohort-related studies.
Right.
But people, suffice to say, look at your diet. Don't overdo it in terms of red meat there, and processed red meat in particular.
Yeah.
And look at alternative options such as plant-based protein.
Okay, lastly, maybe the definition of obesity is changing. It used to, I think, just be essentially at the population level, just a threshold on the body mass index over a certain amount. But now they might add and I don't even know who the they is. That's why another factor might be added.
Yeah, this is a body of global experts. This is a study that got published in a reputable journal recently. There's a lot of discussion ongoing. I don't think this will happen overnight, Tim. This will be a process because people tend to like easier definitions which make sense.
Right.
So this is a little bit more complex. It requires a health assessment. Basically, it divides people into either clinical obesity or preclinical based on do they meet the definition of obesity.
Yeah.
It's not only BMI of more than 30.
Okay.
It's BMI, waist circumference, and whether there's organ or tissue damage. Do you have high blood pressure? Do you have heart disease?
Okay.
Kidney, liver problems? If not, then you're in the preclinical obesity stage. Regardless, the interventions would be basically what we're doing now, but it will target an audience that a group of people that are currently not being captured under the clinical definition of obesity that we use now.
There you go. I'd like to talk more about that. Maybe we can
Sure.
this time next week. Dr. Hussain, thank you so much for joining us today. Fist bump.
Absolutely.
Keep the germs away. Symphony, we'll send it back over to you.